Most people think that neurosurgeons only treat brains, but a very major part of our practice is usually in the spine, and we treat ailments of the neck and lower back a lot. Lower back illness tends to be the second most common thing that people go to an emergency room for. So the reason that people would come to us is if there is a back ailment that may require surgical intervention. They usually get to us through an emergency room situation or by referral from one of their primary doctors.
If you listen to people, that's probably the majority of figuring out what's wrong with them. The physical exam helps, the studies, the MRI, CAT scan, plain films help, but really listening to the patients goes a long way in really understanding what is the organic problem that needs to be fixed, and then really trying to figure out what's the least invasive way to fix that problem.
Many times when they come to our office, we will go over their records and we will treat them accordingly based on what we find on our examination and through their studies, and many times that turns out to be something that's not surgical.
When it comes to the spine, I feel like I am very much a minimalist, conservative, and I always tell people the best surgery we do is none.
When we have a patient who turns out not to be a surgical candidate, we will refer them off for other treatments, including physical therapy, management in a pain center, and other modalities of physical treatment, including chiropractics and acupuncture.
I really enjoy, if I can, doing a smaller procedure than a bigger procedure. Now, having said that, I love doing small window openings in the back of the neck to free up a nerve that's being pinched, or in your back if you have a herniated disc and you didn't get better with physical therapy, tincture of time, acupuncture, chiropractic, anything. If you really are miserable or you have weakness, or God forbid you have bowel and bladder problems, you know, I love sneaking in there. There's nothing more fulfilling than taking out a huge herniated disc and it's kind of limp in, leap out. These patients do very well. They're usually home within just under a day, and they're happy.
Part of what we do is also reconstructing the spine, and there's all new technologies as well as for the implants that we use in order to make the spine more normal or make it look like it's back to normal.
And then on the neck side, I like doing the cervical surgeries. If I can go from the back, very few people go from the back anymore. Sometimes it's kind of like a tree branch on a phone wire. We'll go in and just make a little window opening and free up the nerve root. If the person has trauma or there's instability, we can stabilize it. Sometimes we'll go from the front. Dr. Bethel is wonderful at doing, and Dr. Liang at doing these artificial discs, and they've really taught me how to do that artificial disc, the total disc replacement therapy, which I think, again, is a wonderful thing to have in our toolbox. However, the window of who gets an artificial disc is still fairly small. I mean, it's a wonderful option for the right patient.
Many times the patients come to us very, very debilitated by their illness, and we can do certain techniques in order to make their lives better so they can get back to their normal activities of daily living.
And I think so much of medicine is about doing the right surgery for the right patient.